So that's what I've just shown you. And then we've got new materials. There's a thing called trabecular metal. Yeah, I've got a little badge made out of it here, which you can just pass around. If you just feel this, you'll feel how sticky this metal. Actually, the metal feels sticky. And that's a badge made out of this material. And this is actually, I know this is a bit scientific, but it's quite interesting. This is a microscope picture of it. And on the right here, that's the metal, all blown up like a honeycomb, so you can see it's all magnified. And on this side, it's actually real bone. And the bone, what this is showing is the bone growing into this bone. So even though that hasn't got any chemicals or anything, because microscopically it looks like bone, when we put that stuff in, the bone just grows into it, it becomes part of the bone. And so a lot of our new implants use this kind of technology. So again, they just don't wear out. It's very exciting. Right. These are just x-rays just to show you what a hip replacement looks like on an x-ray. This is a worn out hip here, and what we've done here is we've just covered it. This is where we've just put a cap on the end of the hip so that it doesn't rub anymore. Just x-rays showing that we can replace a whole knee if necessary, a whole half a leg if it's worn out. This is replacing a whole half of a thigh bone. So we have, and this x-ray here is to show that if we need to, we can actually replace a knee and a hip all at the same time. That's all connected, all the way down from the hip to the knee. So, obviously that's a very severe case. But it doesn't really matter what the problem is within the joint. Pretty much now, we can deal with it. It's a very exciting time. And this is the last thing I was going to talk to you about before I answer any of your questions, which is this shockwave machine. And some of you might have heard of people who've had kidney stones that have them broken down with shockwaves, because that's where the technology started. But now we can use this to treat problems like Achilles tendon, tendon in the back of your heel, if that's painful, plantar fasciitis, which is pain in your heel, pain in your shoulder, or tennis elbow even, which a lot of people get. And what this is, it's a machine that fires a shockwave. It's a bit like a jackhammer, and it doesn't actually go into the skin. It's not invasive, but it just taps the painful area very, very, very quickly, and that causes the blood to flow into it and for the thing to settle down. So if you've got an inflamed tendon, it helps to settle it down. And we've been using this for the last year now, and we've been looking at all our results. It's very, very promising. It's fine, don't worry. It's very, very promising for these kind of problems. A lot of things that couldn't be treated, or a lot of things that people have had injections and physiotherapy for, and they keep going back to their doctors over for a year or two with these just little niggly pains. We find this really, really helps. And again, that's available here locally. Thank you very much. Please.
How long does the knee operation take?
Good question. What sort of knee? The keyhole? Knee replacement. A complete knee replacement takes about an hour and a half to do. The way we do it now, in West Herts, we actually do most of our surgery now at St Albans, as you may know. We run a thing called an enhanced recovery program, so people get in and out really quickly, don't worry, and smoothly. So it's great. You come up actually, and everyone explains everything to you, the nurses and the physiotherapists and everything before it even happens. They explain to you what you can expect during the operation. Most people in for only about 3 days. And believe it or not, we do most of these operations while you're awake. So you don't have a general anaesthetic. When I say awake, even a knee replacement. The reason for that, what we don't want to do is, the old anaesthetic where you have a tube down your throat and they breathe for you. That's not a great thing to do. We try and avoid it if we can. So what we tend to do is do it under local anaesthetic, where you have a little injection in the back and it numbs you from the waist down. But you can be asleep at the same time. They can give you something that makes you drowsy so you go to sleep. Or if you want to be awake and join in with the music and everything, then that's fine. but the point of it is, it doesn't hurt. And we get you up very, very quickly after, so you don't have that horrible after effect as if you've had this big operation, you can't breathe properly and everything. That's the key to it.
Yeah. Because I had mine 4 years ago.
Yes.
Completely.
Yes.
And I'm waiting for another one.
All right, where?
I'm going to Watford General.
Yes. You know, all right, so you're on the waiting list at the moment?
I have got a date.
Oh, right. So is that at St Albans or at Watford?
No, Watford General.
Oh, right.
And I'm a bit worried about it, the pain afterwards.
I assume you're not under me at the moment.
No.
I'm sure I would remember you. The pain, we run it slightly differently at Watford, although we do have another system there for getting you home quickly and have physiotherapists at your home afterwards, the Medi-Home, so that you can get up and about quickly. But it is uncomfortable, there's no question about it, but it's not dreadful. We give you plenty of painkillers, and there's no reason why you should be in agony. Were you in agony the last time?
Oh, yeah.
I think you'll find it's a lot better than it was the last time.
I have to go in again because of thrombosis.
Oh gosh, yes.
Yeah, really.
That's a bit unlucky. That doesn't happen for... Yeah, well, that's probably why we're doing it at Watford. But we'll cover you with blood thinners around after surgery and everything to make sure you don't get that.
Yes.
Absolutely.
That's a bit worrying.
No, I have to say, I think you'll find this time, because we've shaken things up a little bit, and I think you'll find that this time it's a much more comfortable experience. Assuming they get you a bed on the day.
Okay. Well, what I don't understand, they said to me that I should have a blood test before going in.
Yes.
And I'm admitted at 7 o'clock, so how can I get...
No, have you been to the pre-admission?
I have.
Yeah, those are the blood... Oh, you on warfarin?
No, I'm not.
No, you'll have had all the blood tests at pre-admission.
They said to me I must go... They gave me a leaflet, which I'm going to take to my doctor. They said I have to get a blood test the day of my admission, and I don't know how I can do it.
Don't worry about it.
Okay.
I'm not sure what that blood... The only one it would be if you're on blood thinners already, if you're on warfarin.
I have done the assessment.
If you're on, if you've done the pre-assessment, that's all you should need.
And also take my tablets that I'm taking.
Take the tablets, unless you're taking warfarin. That's the only one we tend to stop.
So what about the aspirin?
Aspirin stop 5 days before.
5 days before.
Yes.
What amount of water do I have to take?
You need to. You can just take a tiny sip.
A tiny
That's
sip.
fine. You can, whatever you need. Water is fine. Just to take the tablets is absolutely
Because they
fine.
said nil by now.
Nil by is fine. You can have clear fluids up to 2 hours before surgery, so that's absolutely fine.
And that you have made clear.
Good.
Yes. Thank you.
So,
Yes.
the injection in the knee with the jet,
Yes.
do you have a local before that goes in?
Well, it's a good question. The jelly injection is a little bit more uncomfortable than a normal cortisone injection. So when I do it, I tend to numb the skin first. But it's your choice, because that's 2 injections.
I don't want it too long, it's numb.
Sorry?
I don't want it too long, it's numb.
Yeah, well, to numb it, you have to have an injection.
Yeah, I know.
But that stuff, the jelly itself doesn't have any anaesthetic in it. So you either brave for sort of 5 seconds while you have the injection, or you brave for 2 seconds while you have the numbing injection, and then you have the jelly injection.
And that gel looks quite thick, isn't
It is. I have to say, I did one yesterday, and I put a bit of local in it first. I tend to do it that way first, so it doesn't hurt.
How long does it last?
That probably lasts a bit longer than the cortisone injection, up to 6 months to a year.
Because I had a cortisone injection 3 weeks ago.
Yes.
And it's already gone.
Yeah. So there you go. So did your doctor do that?
Yeah.
Yeah. Well, you can come up and see us, and we can organise the other one for you if you want.
It was good while it lasted.
Yeah.
It's just bearable.
I think if you've had a cortisone and it's probably worth getting investigated now by one of us. At least we can get some x-rays and have a look and see what the state of play is. Yes. Oh, you had it done? Oh, great. It's in Albans?
No,
In Watford, all right.
yes. And then finally it was very exciting. A couple of weeks I must say.
Yes. Oh, wonderful.
And I kind of because I couldn't do so.
Yes, yeah. Oh, fantastic. Oh, brilliant. Brilliant. There you go.
Yes.
I can see you rubbing your knee, so I'm sure you want to ask me. Good hip. Oh, really? You understand that? Who you under? Mr. Rabbit? Okay. So, he's getting a hip replacement? So it's very similar to the knee. I think people actually recover quicker from a hip replacement than they do from a knee replacement. In fact, you can't really compare the two because as much as I enjoy doing both operations, I don't think we've got knee replacements quite right yet. The knee is quite a complicated joint. And what we're doing is we're giving you something that we think works like a knee, but it probably doesn't quite. And so although it helps your pain, it never feels quite like a knee again. And it takes a while to get used to it. But with a hip, the next day you get up and that horrible pain that you've had goes. You've got a bit of discomfort from the operation, but you know the difference straight away, and it works very well. So hip replacement is a much more predictable operation. So I think you'll find we do very well. And again, we have the same enhanced recovery program. So have you been to the hip day? You've been to hip school? You don't want to go? You'll get a call from Sylvia asking you to go. And you go with a friend, and it's quite good because it tells you everything that you can. Obviously, we've talked now, but if you are in any way worried about it, it actually puts your mind at rest. And the feedback we've had from patients that have been on it has really been positive because you just know exactly what's going to happen.